Now, meanwhile, India's COVID tally is set to cross the 12 lakh mark today. India reported over 37,000 fresh COVID cases and more than 684 deaths in the last 24 hours. With this, total coronavirus cases in the country have increased to 11.9 lakhs, while the death toll stands at nearly 28,000. Now, Maharashtra and Tamil Nadu remain the worst affected states. The recovery rate in India stands at 63.1%. States like Bihar, Sikkim, Nagaland are under complete lockdown, whereas West Bengal has announced a 2-day lockdown every week. And states such as Punjab, Uttar Pradesh and Madhya Pradesh have opted for weekend lockdowns. With over 1,000 fresh cases in a single day, which is the highest single-day spike so far, Kerala is now mulling reimposing a total lockdown. Now, Chief Minister Pinarayi Vijayan has said that although it's not been decided yet, the state government will have to consider it. Now, the state reported 1,038 fresh COVID-19 cases, including 24 health workers and 5 councillors, taking the total infection tally to in fact, 15,032. As many as 8,818 people are presently under treatment, with 53 of them in intensive care units. Kerala crossed the grim milestone of 1,000 cases in a single day, nearly 2.5 months after the state on the 8th of May had declared that it had flattened the COVID curve. Well, going across to Neetu, who joins us from Thiruvananthapuram for more on the phone line. Neetu, the Kerala government reportedly mulling reimposing a lockdown. According to your sources, what are the chances of this actually happening?
So, Kerala Chief Minister has said in this daily press conference while talking about the COVID cases, since it is the first day since Kerala has crossed 1,000 cases in a day, 1,038, since the first case was reported in the state on January 30th. So as measures were when asked whether a total lockdown will be imposed, he said that we have already we had earlier been under a total lockdown, but there are many opinions coming in that is needed. So what he said is that there has no decision been taken yet on this, but we might have to think about it, and we will look into all aspects before taking a decision. This is what the Chief Minister has said when asked about a total lockdown.
Right, because Kerala was one of the few states, Neetu, that had claimed that they had beaten COVID. They had announced that the curve was relatively flattened. But now, over the last couple of weeks, ever since the expats have returned, there's been a huge surge.
Kerala has not claimed, the government has not claimed that they have flattened the curve or that COVID is over. What they have said is that as of now, this was in the first week of May, when there were days when 0 cases have been reported for at least 4 to 5 days together. So the curve was actually flattened at that time, but the government was very clear that once people will come back into the state, both from abroad and from other states, there will be a surge in cases. So they have been planning for that, and that is what the government has said all along. But right now, the problem is that because till about 2 weeks back, it was mostly the import cases, that people coming from abroad and other states which has tested positive, and the contact cases have been very less. But in the past 2 weeks, the situation has changed. Now, it is a contact cases are more. Yesterday also, of the 1,038, about 700 cases are through contacts. So that is something which which is a concern. The situation is severe, and the state, there are many clusters right now. There are many containment zones, especially the coastal area remains a major concern mainly because of the population density also. And 8,818 cases are the positive active cases right now in the state, which are being treated in various hospitals. The discharge policy in the state is also different. Now, though the national policy has said that there is no need for earlier Kerala followed a double negative was required for discharging a person. But since even after the center has issued fresh guidelines stating that there is no need for it, like if you don't have symptoms for those asymptomatic patients, but till now Kerala Kerala, even now, even for asymptomatic and mild symptomatic patients, only after a RT-PCR test comes negative, these people are discharged. But yesterday, the discharge protocol has been changed. But even now, an antigen test is required to be negative to discharge a person.
All right, Neetu. Thank you for joining us with those updates.